Hey there, beautiful souls. Welcome back to our cozy corner of the internet. I'm thrilled to see you all returning for another video. If you've ever felt a sharp pain in your lower back or leg, you might have experienced sciatica. Sciatica is a common condition that affects many people. It's more common in adults between the ages of 30 and 50, particularly those who have physically demanding jobs or prolonged sitting habits. But what exactly is sciatica? What causes it? And how can you treat it? Well, let's find out. Sciatica is a condition characterized by pain that radiates along the sciatic nerve, which runs from the lower back through the hips and buttocks and down each leg. It typically occurs when this nerve becomes compressed or irritated, usually due to a herniated disc, bone spur, or narrowing of the spine, spinal stenosis, which is the longest and thickest nerve in your body. You have two sciatica nerves, one on each side of your body. Each one of them is actually made up of 5 nerve roots that branch off from your spinal cord and run through your hips, buttocks, and legs. This nerve has both motor and sensory functions, which means it helps you move your leg muscles and feel sensations in your legs. So that is the sciatica nerve itself. But sciatica, on the other hand, is not a disease by itself, but a symptom of an underlying problem that puts pressure on the sciatica nerve. Some common problems that can compress or irritate the sciatica nerve are: number one, herniated disc. A herniated disc occurs when one of the intervertebral discs in the spine, which act as cushions between the vertebrae, becomes damaged and its inner gear-like core leaks out through a crack or tear in the outer layer. This can put pressure on nearby nerves, including the sciatic nerve, leading to pain, numbness, or weakness, particularly in the back legs or arms, depending on where the herniation occurs. Number two, spinal stenosis. This is a narrowing of the spinal canal, which is the space where your spinal cord and nerves run. Spinal stenosis can compress the nerve roots that lead to the sciatic nerve. Number three, spondylolisthesis. Spondylolisthesis is a condition in which one of the vertebrae in the spine slips out of place, sliding forward or backward over the bone below it. This can cause instability and misalignment of your spine and pinch the nerve roots that connect to the sciatica nerve. Number four, piriformis syndrome. The piriformis is a muscle in your buttock that helps you rotate your hips. Sometimes this muscle can become tight or inflamed, which can irritate the sciatic nerve that runs underneath it. Number five, injury or infection. This is when trauma or inflammation affects the sciatic nerve or its roots. Number six, pregnancy. As your baby grows, it can put pressure on your lower back and pelvis, which can affect the sciatic nerve. Hormonal changes during pregnancy can also make your ligaments more lax and cause instability in your spine. Symptoms of sciatica. Sciatica can cause different symptoms depending on which nerve root is affected, but some common symptoms are: number one, pain. Sciatica pain can be mild or severe, and it can feel like burning, like electric shock, stabbing, or shooting. The pain usually starts in your lower back or buttock and radiates down your leg. It can affect one or both sides of your body. Number two, numbness. Sciatica can cause loss of sensation or tingling in your lower back, buttock, leg, foot, or toes. Number three, weakness. Sciatica can cause difficulty moving or controlling your leg muscles. You may also have difficulty sitting, standing, walking, or bending, as these activities can aggravate the pressure on the sciatic nerve and then worsen the pain. Number four, reflex changes. Sciatica can sometimes affect your knee jerk or ankle jerk reflexes. Diagnosis of sciatica. The diagnosis of sciatica typically involves a combination of a medical history review and physical examination. Your doctor will ask you about your symptoms, when they started, how they affect your daily activities, and what makes them better or worse. Your doctor will also check your spine, hips, legs, and feet for sign of nerve damage, such as muscle weakness, numbness, or reduced reflexes. Imaging tests such as X-rays, MRI or CT scan may be needed to look for the cause of your sciatica. If you have sciatica, there are some things you can do to relieve your pain and improve your function. Some examples are: number one, rest. Avoid activities that trigger or worsen your pain. Taking short breaks from activities that aggravate your sciatica, such as heavy lifting or prolonged sitting, can help relieve pain. After resting, gentle stretches and slow walking can help improve circulation and prevent muscle weakness. Resting can help reduce inflammation and pressure on the sciatic nerve. And number two, applying ice and heat packs. Applying ice and heat packs to the painful area can help ease muscle spasms and reduce inflammation. Just be careful not to burn or freeze your skin. Ice packs are most effective during the first 48 hours after the onset of sciatica pain or during flare-ups when inflammation is at its peak. Number three, medication. Over-the-counter pain relievers such as ibuprofen or naproxen can help relieve inflammation and pain. Your doctor may also prescribe other medications such as muscle relaxants with steroids if needed. And number four, physical therapy. A physical therapist can design a personalized exercise program that targets the root cause of your sciatica and strengthens the muscles that support thee. And that can strengthen your core muscle, improve your posture, increase your flexibility, and reduce the pressure on the sciatic style. Most cases of sciatica resolve within a few weeks or months with conservative treatment. However, if your pain is severe, persistent, or interferes with your daily activities, you may need surgery to remove the part of the disc or bone that is pressing on the nerves. Surgery for sciatica is usually considered as a last resort when other treatments have failed, or when you have severe symptoms such as loss of bladder or bowel control, sexual dysfunction, or progressive weakness in your leg. The advantage of surgery here is that it can provide immediate relief from pain, but it also has risks and complications, such as infections, bleeding, nerve damage, or failure to improve. As for the prevention, sciatica can be prevented by taking care of your spine health and avoiding factors that trigger or worsen your symptoms. Here are some tips. Number one, exercise. Regular physical activity helps strengthen muscles that support the spine, improve flexibility, and reduce nerve irritation. One effective approach is low-impact aerobic exercises like walking or swimming, which improve circulation and promote healing without putting excessive strain on the lower back. Strengthening exercises target the core, back, and legs to enhance stability and reduce pressure on the sciatic nerve. Number two, maintain a healthy weight. Being overweight or obese can put additional pressure on the spine, particularly the lower back, where the sciatic nerve originates. Losing weight reduces the load on your spine, which can help prevent nerve compression and sciatica flare-ups, and also improve overall health. Number three, use proper ergonomics. Ergonomic practices help maintain proper posture, reduce strain on your muscles and joints, and minimize the risk of nerve compression. When working at a desk, ensure that your chair supports your lower back with your feet flat on the floor and your knees at or below hip level. Your computer screen should be eye level to avoid neck strain, and your keyboard and mouse should be positioned so your arms remain relaxed at your sides. Take regular breaks to stand, stretch, and walk around, which can alleviate tension and improve circulation. If you lift heavy objects, use your legs instead of your back, keeping the load close to your body. At the end, sciatica can be a painful, frustrating condition that affects your quality of life. But with proper diagnosis and treatment, you can recover from it and prevent it from coming back. We'd love to hear from you. Please share your experience with sciatica in the comments below. Thanks a bunch for tuning in. I hope you enjoyed the video and found it useful. Your support really keeps me motivated to create more great content. Catch you in the next one.